comparative dimension here. And the title of the presentation is Policing the Maternal Mind, Prenatal Care and the Psychologization of Pregnancy.
Thank you very much. I'm so happy to be here as well. It's only the second talk that I'm giving in person since before the pandemic, so still bear with me. You can still find everything I need. It was so interesting to hear all of the presentations so far. I'm taking you into a bit of a different direction, talking not about the body, but about the mind during pregnancy. And what I call the psychologization of pregnancy. So, of course, we talk a lot about the medicalization of pregnancy. And that's something that has been very well studied, how pregnancy over the course of the 19th and 20th century has become very much of a medical experience in Western societies, full of checkups and tests, and how medical experts enact a form of surveillance of pregnant bodies. And all of the presentations we've heard so far were examples, very good telling examples of that, with the ultimate goal to ensure a timely and healthy development of the fetus. What I propose to turn our attention to is how over the course of the 20th century, pregnancy has also become a psychological object of knowledge. And I mean by that how pregnancy has become an object of study for psychology and psychiatry, how psychological experiences of pregnancy have been theorized and defined, and how this psychologization has happened in parallel and sometimes in contradiction with medicalization. And to do that, I will take you on the same journey I did with this topic when I became aware of the importance of psychological discourses on pregnancy during my fieldwork in a prenatal unit in Switzerland. That was not the topic of my dissertation at first. I was not expecting to encounter psychological discourses on pregnancy, but it became more and more important during my fieldwork. So the starting point of all of that for me was the ethnography I conducted for my doctoral research in a prenatal care unit in French-speaking Switzerland called the Perinatal Unit, well, a French equivalent of that. The Perinatal Unit is not a typical pregnancy care center. It does not offer any medical care. That's not the point, so no screening, no ultrasounds, nothing like that. But they offer what they call psychosocial care. It was created in 1986 by a midwife and a social worker, and they started working together, offering appointments to pregnant women, basically to have time to talk about all of the other aspects of pregnancy that were not strictly medical, to talk about how they felt during being pregnant, psychologically, physically, about their maternity leave arrangements, their financial situation, everything that was not strictly medical. So the goal was, and still is, to counterbalance some of perceived shortcomings of medical prenatal care. In Switzerland, as in many other countries, but pregnancy is very heavily medicalized. Pregnant women usually are supervised by private gynecologists. That's how it's organized in Switzerland. And these gynecologists offer 15-minute appointments. So that's very short. So it was felt that gynecologists had no time to talk with their pregnant patients. So this unit, the goal was to counterbalance this shortcoming of medical care. Since then, since 1986, the unit has grown and was employing about 20 midwives and social workers at the time of my study in 2011 and 2013. They were seeing 2,400 patients every year, which amounts to approximately a quarter of the pregnancies in the regions. So just to give you an idea, it was approximately 1 out of 4 pregnant women who had an appointment there during their pregnancy. The appointments were free because the unit, although it was run by a private foundation, it received state funding as part of a public health program. The perinatal unit always relied on the idea that everybody has questions during pregnancy. So the unit is very much oriented to the general public and not to specific vulnerable parts of the population. The intent was really that anybody has questions and we are happy and we would like to see every pregnant woman coming through the doors for at least one appointment during pregnancy. Their clients, they didn't call them patients because they wanted to differentiate themselves from a medical unit. So their clients were sent to the perinatal unit by the gynecologist in general, who would recommend such an appointment. So there were differences there and regional differences because some gynecologists would recommend such an appointment to all of their patients. Others would only do so when they felt the pregnant woman was vulnerable or needed extra support or had a specific questions. So the clients of the perinatal unit were more or less representative of the general population in terms of class, of migration status, education level. There was just a slight over-representation of the most vulnerable groups, like unemployed person, undocumented migrants apparently was sent to the unit more often by the gynecologist. A typical appointment would last 60 minutes, so that's much more than the 50-minute appointment with the gynecologist. And pregnant women were asked about their general well-being, their emotional state, their financial and professional situation. They were provided with information about healthcare access, different hospitals they could choose to give birth at, social services, support groups, depending on the topics that were discussed during the appointment. And this is how, at the time of my study, the unit presented itself on its website. So I've translated the little bubbles there. So they say pregnancy, maternity, paternity, professionals with whom you can talk. And in French, the word professionals were used in the female form. And be well informed to welcome your baby. So you can note that the unit wanted to appeal to both women and men. In fact, in reality, only a third of their appointment was attended by a pregnant client and their male partner. You can also see how heteronormative and white the first image of the unit is. They said they were very open to same-sex couples, but in fact, it was extremely rare that LGBT people would attend appointments there. And at the end of my ethnographical work, I discussed this with the head of the unit and pointed that the image and visual presentation of the unit might contribute to projecting a heteronormative image of the unit and of the public that might be off-putting for queer families. And so they have since changed their imagery. So that's why how it was a few years ago, but they have changed. They also changed the color. They don't use pink anymore. They use orange, which was perceived as a bit more neutral. But it was interesting to see how the imagery, the images they use evolved. A last comment, that the fact that they use the word professional in the female form in French reflects the fact that only women work there and only women have ever worked there. Again, they told me that it was not a choice, but that it ended up that way, that they only hired female midwives and female social workers. So it's in this context of the perinatal unit that I heard for the first time discourses that frame pregnancy as inducing a very specific psychological state in pregnant women. And these are extracts from interviews I did with midwives of the unit. For pregnant women on the psychological level, their unconscious works a lot. It's at skin level. Maybe it raises sometimes anxiety. It forces them to figure out who they are, their relationship to their mother, leave the little girl, project themselves as mothers. So suddenly they can feel anxious, stressed, impulsive, and not understand why. And another one, Cecile, a midwife too, pregnancy causes many things to come back to the fore. Things related to the relationship with one's own mother. It's a whole adaptation, a physical but also psychological and mental change, since nature does things well in order to be ready to become a mother. So actually this idea that pregnancy was a time of psychological change and psychological vulnerability was one of the cornerstones of the unit as an alternative model of prenatal care, alternative to medical care. These midwives told me these ideas about pregnancy doing interviews with me as a way to justify the importance of the unit. Pregnant women are in a psychological turmoil, in their view. Gynecologists don't have the time nor the skills to address this, so the perinatal unit is needed as a psychological complement to medical care. And I was struck by the use of psychological and even psychoanalytical vocabulary by midwives who don't have training in psychology. So from there, I started to dig and to see if I could follow this conceptualization of pregnant women as experiencing very specific psychological processes in the psychological literature. So I will now turn to the genealogy of this idea of pregnancy as a crisis. I will later come back to the perinatal unit and see how these ideas have translated into practice. So now I'm going back into history. First, attention to the pregnant mind is far from new, quite obviously, and has taken different forms over time. This is not exhaustive, but it's the main forms it has taken. During the Renaissance already, the doctrine of maternal impressions was quite popular in medical discourses. The idea behind maternal impressions was that the body of a fetus could be affected by emotions experienced by a pregnant woman. So if a baby was born with lots of hair, for example, it could be explained by the fact that the mother had been scared by a bear or a dog during pregnancy. So it was a way to explain unusual outcomes or unusual traits on the fetus body, like birthmarks as well. And this idea, of course, the idea of explaining hair that way make us laugh a little bit, but it has somewhat traveled all the way to contemporary biomedical research, like epigenetic and DOA, so the developmental origins of health and disease, which are fields that currently investigate the impact of maternal stress on fetal health. So there's still this idea that what a mother experiences during pregnancy can durably influence fetal health and even the very construction of a fetal body. So it has a long history. And on that topic, I can only recommend Tara Richardson's latest book. It's really very, very interesting on that topic in epigenetic. Later on, say from the 19th century approximately, an interest in psychopathology appears. That is explaining things that go wrong, like miscarriage, or side effects, like nausea during pregnancy, with psychology. For example, nausea during pregnancy has been famously explained as an unconscious rejection of the fetus, right? This was a way to explain something that went wrong during pregnancy. This has also evolved into the diagnosis of prenatal depression. Postnatal depression is well known, but there is also prenatal depression. That's a very interesting diagnosis. But this is again a subgroup of this is about a subgroup of pregnant women who are diagnosed with specific psychological problem. In contrast with the third point that I've put there, which is the interest that has developed in ordinary pregnancy. So not pregnancy where something goes wrong or something bad happens afterwards, but an interest in what happens on a psychological level during a quote-unquote normal pregnancy. And this is the type of discourses I heard at the perinatal unit. I did that it was normal to experience psychological processes that were specific to pregnancy. And what I was hearing was an idea that pregnancy per se was causing specific psychological processes. So I tried to understand where this particular idea came from. And what I found is that the psychology of ordinary pregnancy originates in the work of 3 psychoanalysts who worked and published in the US between the 1940s and the 1960s, Helen Deutsch, Therese Benedect, and Grete Bigbring. You might never have heard of them, but Deutsch was actually a student of Freud directly, and she was the first psychoanalyst to specialize in women's psychology. So she's still quite famous. In women's psychology, she's still regarded as a pioneer, included by feminist psychologists nowadays. And they all held very prestigious positions in US universities, so they had quite amazing careers. And they all built their arguments successively, using each other's work around the same argument: in every woman, pregnancy is a psychological challenge. So Deutsch was the first to publish in 1944, 1945. She published 2 volumes of her Psychology of Women. And she writes, pregnancy is a tremendous upheaval for the feminine organism, and that pregnancy may disturb the psychic balance because it brings to the fore old conflicts that have hitherto remained relatively dormant. So this is the first basic idea. And then Benedek built on Deutsch and compared pregnancy with other developmental stages like puberty. And she writes, pregnancy, like puberty, is a biologically motivated step in the maturation of the individual, which requires physiologic adjustments and psychological adaptations to lead to a new level of integration that normally represents development. And then later on, Bigbring also built on this and introduced the notion of crisis to describe pregnancy. And she writes, pregnancy, like puberty or menopause, is a period of crisis involving profound psychological as well as somatic changes. These crises represent important developmental steps and have in common a series of characteristic phenomena. This disturbance in the equilibrium of the personality is responsible for creating temporarily the picture of a more severe disintegration. So it's not always easy to understand because the vocabulary is not always familiar when you are not trained in psychoanalysis, and I'm not, so I had to work on that. But if we pause for a minute here, there are several elements that are pretty interesting. First, these 3 authors share quite obviously a psychosomatic analytic frame in which when a change happens in the body, meaning hormonal changes, it also induces changes in the mind. And this is why they compare pregnancy, puberty, and menopause. There are three moments in a woman's life where something happens hormonally, and they argue that something also happens psychologically. And this discourse conveys the idea that a woman's life consists of a succession of biologically motivated steps that enable development, as they say. So you see here a version of maternity is a woman's destiny in a way, a cultural trope that feminists have abundantly criticized, starting with the Beauvoir and many others in different ways. But behind Bibring's words, like the idea that women grow psychologically through puberty and then pregnancy and then menopause. Now, of course, quite obviously, pregnancy is not a step that all women will go through. So the question remains open as to how we should consider within this framework women who are never pregnant. Did they miss a developmental step? And this is not a question that the authors really address. Unfortunately, it would be interesting to see how they respond to that, which show this conflation of the woman with the mother in these texts. And then the last sentence here is also interesting because pregnant women are described as giving temporarily the picture of a more severe disintegration, meaning for a while they are pregnant, women look like they have totally lost their psychological balance. So we see here that all pregnant women are described as basically looking like they are mad, which is pretty striking. These theories are not marginal or anecdotal. They are still today very much cited in publications in psychology, in psychiatry. I've heard these authors cited by prominent doctors in Switzerland as the very core of what they were doing for pregnant women and in the postpartum. So these are really still very much alive. Now, these ideas of pregnancy as a crisis have traveled into Francophone psychology as well, and it is through the work of French psychiatrists that the Perinatal Unit staff learned about these ideas. The staff there, they don't read English fluently, so they read French psychiatrists who kind of convey these ideas. Both Monique Bidlowski and Françoise Molena, that you can see here, are well-known psychiatrists and psychoanalysts in France, and they have been massively influential in framing pregnancy in France as a period requiring psychological support. Molena in particular has successfully lobbied the government in France to introduce a psychosocial appointment for every pregnant woman during the 4th month of pregnancy, this thing that's very similar to what the Perinatal Unit is doing in Switzerland, offering at least once during pregnancy a time to talk about psychosocial questions. And it is Bidlowski who wrote that pregnant women's unconscious was at skin level, as she says, and these very words were used by a midwife in one of the quotes that I gave at the beginning. So now, coming back to the Perinatal Unit, after reading these psychoanalysts, I was struck at how I could literally find the same ideas and words in my interviews with midwives. I heard staff members relay what I call the crisis model of pregnancy, or pregnancy as a normal crisis, right? So this psychoanalytical idea that pregnancy is a time of psychological remodeling. For example, Cecile again said, it is true that during pregnancy, a woman is totally open in her entire being. She wants everything to go well for her baby, so it's the right time to re-examine things. They have that kind of openness. Or elsewhere, she said it's extraordinary what happens during pregnancy because the woman, her baby puts her in touch with her inner self. And it's a crisis situation. So they have really this idea that their psychological state is very special, very specific to pregnancy. And it seemed that this idea that pregnant women were experiencing some sort of crisis had become accepted knowledge and the lens through which pregnant women were seen. 2 comments can be made on the adoption of these ideas on pregnancy among health professionals. First, of course, this kind of discourse can be used as a strategy to get funding and to offer more comprehensive support to pregnant women, which is, of course, a very good thing, and especially to those who have mental health issues. By arguing that all pregnant women are vulnerable, it's easier to leverage support for health programs. And this has been successful in France and in Switzerland. But on the other hand, framing pregnant women as in crisis also kind of reactivates pre-existing assumptions of the frailty of women's psyche, their instability in comparison to men. Women are said to go through these intense, hormonally driven developmental phases throughout their lives, where they are deeply troubled. And this resonates with stereotypes that psychiatry has perpetuated about women being more vulnerable than men. Now, this view of pregnancy as a psychological crisis also impacts the kind of advice staff at the Perinatal Unit gave to their pregnant clients. I will now turn to 2 examples where midwives advised their clients to manage their emotions in a way that was considered safer for the fetus. In the first example here, I will read the words of a midwife speaking to her colleagues during a staff meeting. So that was not an appointment, that these were midwives and social workers speaking to each other about cases, so about patients, clients they had seen. And this midwife was explaining how she handled a pregnant client who was visibly upset during an appointment. The situation was the client, Mrs. C, was pregnant, but her partner doubted he was the biological father. And during a previous appointment at the perinatal unit, the partner was here and had asked for a paternity test to be performed, which made Mrs. C very angry. And then the midwife met Mrs. C again on her own and encouraged her to manage her emotions. And I read the midwife's words. I met Mrs. C again on October 9. She came alone. It allowed me to talk about paternity testing, to explain its meaning, and to say it's not against her, the usual blah, blah. And then she was so angry. She said very aggressive things like, I'll beat him up. So her partner. I tried to calm her down. I came back to her pregnancy. I showed her some pictures and she calmed down. Then I was struck to see how violent she was. I said, the words you said, the things you say, you are pregnant, you know. I didn't want to make her feel guilty, but to tell her, not only will your child not be able to live in an environment where people are threatening each other and are being violent, but right now, when you're talking, when you're screaming, your child hears things. You will have to work on that anger in order to cool down. We did a few relaxation exercises. I encouraged her to learn how to manage her emotions. I'm worried. So here, what the midwife communicates to her pregnant client is that her behavior is inappropriate during pregnancy. It's too violent, and that she should actively manage her emotions, tone them down, or else she will harm her fetus. The fetus that Julia names baby, as is very usual in that context, is framed as the victim of his or her mother's emotions. Of course, you can hear the echoes here of this idea that strong emotions have an impact on fetuses that I mentioned before. This idea that goes back to the Renaissance is quite obvious how there is some kind of continuity. And then what struck me also is that the midwives did not seem to address or offer support in relation to the reasons underlying Mrs. C's anger. The only response to the client who is visibly upset, maybe because she's hurt by her partner suggesting she has cheated on him, the only response is tone down your emotions because you're harming your fetus. This resonates a lot in my mind with literature on the medicalization of pregnancy and how the pregnant body is an object of discipline, right? For example, work on fetal alcohol disorder or on smoking during pregnancy, just a few examples, but there's so many case studies that show that in the name of the fetus, pregnant women are expected to monitor what they eat, how they exercise, with optimal fetal health as the ultimate goal. And this is resonating, I think, very much to that kind of literature, how they are supposed to control their own body to protect the fetus. So now, second example. Here's a very short extract from an appointment I observed. The pregnant client here reported she cried very often during her pregnancy because her partner had left her when he heard she was pregnant. And she shared with Alexandra, the midwife, that she was worried her crying might harm her fetus because she was crying too much. And the midwife answered, you can forget that, it's not true at all. What the child feels is stress, because when not enough blood arrives at the placenta, it leads to a rigidity of the arteries, and this can cause growth retardation. But as long as you simply have emotions, which are natural in your case, we are humans after all. Tell yourself that it's even good for the child that you cry. You are a mother, a natural woman, alive, and that's what he or she needs. In French, the word baby is masculine, so it would always be he, but of course in English it doesn't work that way. It wouldn't be good to stop yourself. Guilt is very bad for the child. You're doing very well. You tell him or her things. You tell him or her it's hard. The child will be able to put that into a drawer, tell him or herself it's not his fault. He won't carry that. So here the midwives communicates hierarchy of emotions. Grief, sadness is natural, it's okay, it's harmless, but stress and guilt could harm the fetus. And you have graphic images of the fetus being deprived of vital supplies and impaired in its development because of these emotions. What is certainly interesting is that there is kind of a paradox here. If the theory is that pregnant women are experiencing a normal crisis, if they are in a very particular psychological state and very unbalanced psychological state because of their pregnancy, they are still urged to control their emotions and not behave in what is considered excessive ways. So now to conclude, what I wanted to show with these two examples is that the psychologization of pregnancy is not only a way to see pregnancy as a psychological event, but it translates into a form of surveillance and discipline of pregnant women's minds and emotions. So in some ways, psychologization extends to the pregnant mind the discipline and surveillance that medicalization has brought on the pregnant body. And many of the observations and analyses that have been made by feminist scholars on the medicalization of pregnancy and its effects apply also to this, this trend of psychologization. For example, just like it has been observed with medicalization, psychological discourses on pregnancy place the interest of the fetus center stage quite clearly. They make women responsible for anything that might go wrong with their fetus. And of course, paternal influences are completely out of the picture. But psychologization is not just an extension of medicalization. In fact, like the case of the Perinatal Unit illustrates, it has often developed into policies that aim to counteract the shortcomings of medical prenatal care. So I have encountered the idea that pregnant women were in a crisis or a particularly fragile population from a psychological point of view in midwifery texts as well. And in the women's health movement, like in the first version, it appears in the first version of Our Bodies, Ourselves, and even in feminist anthropological scholarship. So it has traveled in places where you might not think it would, but that's because it is a powerful argument to advocate for a more holistic approach to pregnancy care. So it is quite tricky to work on that because there are really different facets to this trend. So the pregnancy as a normal crisis concept has been used to promote better care for pregnant patients, and with success sometimes. I think it's also very useful to think of this disciplining of the pregnant mind as an extension backwards of parental culture that we have discussed today, because the role of psychology in parenting has been pretty well studied. It's so interesting, right? How psychology contributes to defining what is good parenting, like with theories such as attachment and all of these so interesting concepts. And so you can see that pregnancy also has become an object for psychology and psychiatry. And so it's a very good illustration of the tendency we see to extend parenting rules backwards. Now we also have to tend to mental health during pregnancy, not just when the child is born. So I think the many different forms and aspects of the psychologization of pregnancy are worth observing with a critical eye. There are very interesting things and very fruitful, I think, but also very worrying and yes, some aspects that are less maybe less easy to take. But while most scholars have focused their attention on the medicalization of pregnancy, psychological discourses on the pregnancy have been much less studied, and I think there is really more attention because they take such different forms. I will stop here, and I'll be so happy to take your comments, your questions. I have an article that speaks to some of what I spoke about today. Please don't hesitate to send me an email if you need the PDF, if you can't access this for any reason. Be happy to share a version of it.
The link to your article is actually up on the CPCS our website on the page about this event. Right. Questions, comments?
Yeah.
Good question, and I might have missed. I missed the first minute of you talked about. I didn't understand that. What did trigger your interest in that topic, in that specific unit? Had it been the object of some criticism, or why did you
I was not actually at the start. I was interested in the unit, generally because they offer this kind of alternative approach to pregnancy, as they say, psychosocial care. And that's what my interest was. I was not expecting to see that much like psychological approach to pregnancy, because they are not psychologists. They have no psychologists in the unit whatsoever. So that was a surprise, something that I kind of found out while during the interviews, and I just became curious about it, and also noticing that there was not much work on these psychological approaches to pregnancy. So that's why I tried to dig and to go back to try to see where these ideas came from. So it was not an initial interest. It very much came out of field work.
very quickly follow up on that? How was it received, like the conclusion of your PhD that part? Did you have a chance to discuss it with them?
Not entirely well. It depends. So in some aspects, we had a very, very interesting dialogue, like what I mentioned about the image, the very, very heteronormative. I don't know if you heard that part, but they used to have a very heteronormative image of the unit with a man and a woman, and they had this pink color that is very much attached to femininity, and they thought, oh, maybe that might be a reason why men are not so interested in coming to the unit. So we had very good talks about that, because I could a bit contribute to their critical reflexivity on their unit and what they were doing. So when it went in the direction of what they were already thinking and trying to find solutions for, it went really well. Other aspects, like, for example, this aspect of maybe framing pregnant women as vulnerable might have some wider consequences that they don't intend to have. They were much less open to discuss that, because they felt they were very worried, and for, I think, good reason, I have to acknowledge that me saying that might undermine their legitimacy and their chances as keeping on receiving this funding from the state, from the government, which was, I mean, vital for the continuation of the unit. So it was tricky at the end for me to have this criticism, but at the same time, obviously I didn't want to harm the unit and the work they are doing. So as a researcher, I find it was really not very easy. Yeah.
Is there evidence for that approach? Like, do women who have a psychosocial approach have better outcomes, and quantitative evidence?
I'm sorry, women who have
these psychosocial appointments, are there any, they have better outcomes? Is there evidence for that approach?
Not that I know of. But they might. I mean, this is not to say that I think it doesn't do anything. Yeah. It's more that I'm not aware of like a study that would have compared. It was pretty much led by these theoretical arguments, and I must say, I mean, these psychoanalytical theories, they were mostly theories. not coming out of surveys or like psychology would do today as a science. It didn't work like that at the time. But these ideas remain really strong and served as a basis to advocate for implementing these kinds of appointments in France and in Switzerland. Of course, you might think that, I mean, having a plate where women can receive some information on, like, for example, the social workers, their help filling out forms to receive some kind of subsidies that are specific to a place or another. You might think, I mean, intuitively that might probably be really helpful and useful. There are other aspects where you might wonder what are we doing? What are they doing in giving this, transmitting this idea that every pregnant woman needs help, basically? But I don't know of any study. If anybody knows of any study that would have been done, I would be interested.
I was struck by there seems to be like a litany of red flags in that account by Julian midwife. Like, oh, my husband wanted a maternity test. And instead of supporting them, they're like, oh, it's not about you, it's not against you. It's like, you know, she really needs some like violence, like intervention here, there's any probing, you know, it felt very much like there is a giant red flag, and just like, it's important you think angry like that.
Yeah, so I can just say when she said it's not about you, she's referring to the fact that their kind of reaction when they were in face of a conflict between parents or couple, they would always say, we take the interests of the child as our guide. So the idea was, it is in the interest of the child to know who their biological parents are. So a paternity test is in the interest of the child. So just do it, basically. But that was very troubling as well, because you might think at first, I mean, defending the interest of the child is a good idea, but it had some really troubling consequences also because we are talking about pregnancy. So the child is not there. And just as in the UK, the child has no legal personality before it is born, which means they were enforcing children's rights before the child was born, which led them also to sometime transmit information about a family to child protection services during pregnancy, even though this is not really within the legal framework, but because they said it would allow child protection services to act faster. And so to prevent, you know, to avoid the situation getting worse. But again, it raises all sorts of questions about the parents' legal rights.
Also, thinking about cultural differences and understanding around pregnancy between perhaps France and the UK. And the reason I asked a totally genuine question that comes anecdotally. So part of my family is French, and a lot of the stuff that the midwife was saying, I've heard my female family members who are pregnant say things like this, and they talk much more openly about sort of the emotions and psychological upheaval of pregnancy. They talk more about this kind of crazy. It seems to be much more part of the care they receive there, whereas that's not something that I hear echoed here, either in my own experience or other experience interacting with antenatal care. I just wonder if there's an aspect of that as well.
Well, that's very interesting. I don't know enough about pregnancy care in the UK to compare, because I didn't do a comparison, but many people here do, so that would be interesting to hear. What I can say is that I'm not sure it would be really part of regular medical care, either in France or in Switzerland, to have these psychological questions discussed, but maybe much more culturally. And again, I don't know how that would be different from the UK, but the idea that when you have all of these hormones and hormonal changes, you know, you tend to, this the whole idea of the pregnancy brain, right? You tend to forget things and behave in an irrational way. And so that would be part of the cultural representation of pregnancy very much. And the other thing that psychoanalysis is very influential, probably more than in the UK. Again, if anybody has more knowledge than I do, I would say that in France specifically, and in Switzerland too, probably psychoanalytical ideas, theories, representations have traveled much more into medicine, into psychology in general. But probably someone else can have more to say about that.
Antenatal depression is pretty embedded now in
Yeah.
concepts in this country. I mean, the whole depression concept's expanded backwards, forwards, sideways, and for men. So, you know, we now have a very active working concept of male postnatal depression, which is counterintuitive, but nevertheless is a working concept.
I guess I'm thinking more of the emotions, you know, when you that quote the winner about, you know, how the emotions I've had that actual conversation.
Yeah.
Wow.
That hasn't applied about how emotions. It's out there, I guess.
It's really interesting because I'm not quite sure where all of that comes from.
Yeah. And
I mean,
they were all kind of, there was a period of time where all of them were they're all, it was like a group discussion about, oh, yeah, I've heard that too.
Right.
I'm now pregnant from a UK perspective. I have never.
Yes, I'm not mad. Sarah and then Rebecca, and then we better finish. Yeah.
So listening to this, it seems that there's a lot of sort of folk psychology, and it's the emotion of pregnancy makes it that sort of thing. Is there any evidence? I'm just getting the people on myself that women's psychology on standard psychological measures, like moving the overview depression from that. Is there any evidence of women's psychology actually changing, like on emotional resilience, or things like personality, or triad, or any of those really established measures? Is there any evidence for any kind of psychological change?
So I'm not sure. I'm not a psychologist, so I didn't do that kind of literature review to see, like, find if there was some hard data. I was more interested in seeing how these ideas had traveled, whether they are, you know, empirically based or not. They were not at the time. They were, I mean, these first three authors that I mentioned, that's quite clearly, again, it was not, I mean, in the 40s, 50s, 60s, they did not do these kind of large surveys that I guess psychologists would do now to try and prove their theories. It was very much more thinking, I mean, yeah, the thinking process, what they observed out of the few clinical cases they had, and making a theory out of it. But that's very much how psychoanalysis works very often. It is not always, or it used not to be, I mean, I have to be careful because there are different, of course, different ways of working with psychoanalysis, but it's very often theories that are theories and that have not been empirically proven. And what I observe also is that these ideas are very much still cited, and these authors are still cited, even though by today's standard, you might say they are just ideas, but they still are very much out there. So that's something that I find really interesting, because there is this, maybe this discrepancy with what you might expect as evidence-based to justify interventions or public health programs, or yeah.
So I wanted to ask this before you said about making referrals to child protection services. I want to ask even more now. So you said that the gynecologists sometimes made referrals into the unit. Was there any sort of tracking information that you other way? Because it struck me that some of the quotes you had, particularly the one about infections, it has parallels with the sorts of discussions that I see in the UK, women whose mental capacity to make decisions about their labour care is in question, because they are unable to control their emotions when they're being asked to make decisions. That's being taken as evidence in some of these cases on the face of it, that they don't have capacity to make decisions. So I wondered if there was, if they were completely separate once a referral had been made, or whether there was, I guess, that risk.
Yeah, so they were separate. Not, I was never made aware of information going to and from the perinatal unit and private gynecologist. But what did happen is that for every appointment at the perinatal unit, they will fill in a form that was called the transmission document that will go to the maternity unit where the woman was planning to give birth. So that was a form with general information. You have alcohol and smoking in there, and you know, emotional states and anything that could have been said. So in theory, that was a form that was supposed to be filled with the client present, and that the person would see what's written there and which information would then travel to the hospital ahead of delivery. But very often, the professional would just have their computer in front of them and typing. So you know how it happens in reality. So there was information traveling that way, which was, of course, pretty interesting. I mean, I had a look at as many of these transmission documents that I could, because I didn't have access directly, but sometimes I could see them in tables lying there. And it was really, really interesting how they would translate what was said during the appointment into something that would, and they told me that they were hoping that their colleagues at the maternity unit would read between lines sometimes, and understand that if they write, you know, tensions in the parental relation, they would understand huge red flag, there might be violence, or we suspect there's something wrong there, but we don't know what. And so there was a whole very complicated communication. And of course, these people, I mean, the ones working in the perinatal unit, they usually knew for example, the midwives working at the hospital in their region. So they would talk. Also, they told me quite clearly, I mean, in corridors, talk about people they met. People, you know, I'm very worried about this one because I don't know if, but I can't write that in the document. So there was a whole range of communication going that way to the hospital. Yeah.
All right, thank you, Edmée.
Thank you.
Okay, I've got one more thing I need to do before we go and drink some wine and possibly eat more sandwiches, which is to say a massive thank you to this person. That's you, Sally. Horrible. Is that side better? This is a photograph taken when we did our event here back in 2018, marking the 50th anniversary of the Abortion Act. That's Wendy Savage there, apart from Sally. Anyway, I've made this, and I've actually got another present as well, because I just wanted to say a huge thank you to Sally. Sally is leaving the University of Kent to go to Bristol. Sally is somebody who has, one way or another, been a partner in crime with me since I started my PhD in 1996. Before that, was it? Right, so a really, really long time ago. In fact, one of the very first events that I ever organised when I was a PhD student, which was when it was the 30th anniversary of the Abortion Act, which we did at Oxford with Sally. And I'm going to miss her absolutely enormously. I know we're going to stay in touch, we're going to try and do something, but I just wanted to say thank you, Sally. She's been a huge part of everything that I've done here. When I did my PhD here, setting up the centre, absolutely everything. So I know we're going to carry on, but I'm going to miss you a lot, as well plenty of other people here as well. So Even if you don't like my cushion. Right, so that's it. Thank you, everybody. But obviously, do stay. The wine, I was hoping we'd have it outside on a beautiful sunny lawn overlooking the campus, but since it's been absolutely tipping it down, that's not the case. It's just around the corner where the sandwiches may still be or not. But anyway, plenty of wine there and some Christmas.